Hey YouTube, sorry it took so long for me to upload this video. A lot's been going on here. I went Monday to my doctor's appointment for my gallbladder, and I met with the specialist. He said it definitely needed to come out, which is kind of not what I was hoping for. But oh well, what can you do? He said that if you don't have it out, it can cause like an infection. It can become infected or whatever. He said that you can develop like pancreatitis, which can kill you, I guess. He said all kinds of nasty stuff. So he pretty much went over the procedure with just a few minutes and went through all the, problems that can occur, things like that. He generally said because I'm young and I'm healthy, other than that issue, that it should be a fairly simple procedure. You go home the same day as long as there's no problems. He said sometimes what does happen with younger people is after they get out of surgery, they have a difficult time keeping anything down. So sometimes you just have to stay overnight, but usually go home the next day. So that was that. And I did talk to him a little bit about scheduling the procedure with my infertility doctor at the same time. He said he's worked with him before and it was no big deal and all that, which was good. And I, left there in an all right mood. But then what happened is I still had not heard back. This happened Monday. And my doctor's appointment with my infertility doctor was last Thursday. And they were supposed to be checking my benefits and giving me a call back. And I still had not heard back, so I gave them a call. And this is where I became so frustrated. Because in my last video, I talked a little bit about how my doctor said something about a pre-existing clause in the policy or whatever. And after I talked to them on Thursday, I thought, okay, I'm fine because I haven't seen him since last year. And it turns out it was October of last year. They don't count the pregnancy test. So it was October of last year. So I thought, okay, I'm fine. Well, it turns out I may not be because they go supposedly. Because I called again on Monday and got a completely different answer. First of all, the girl gave me a huge attitude about me even wanting to know this. I need specifics. I need to know. I know they go 6 months back. Is it 6 months from the appointment? 6 months from the date we got our insurance? 6 months from his hire date? We don't know. So she gave me a huge attitude about finding out. And she had told me, I can't remember what she initially told me, but it was different than what they told me before. I think she was saying they went a year back or something. I don't know. But so I asked to speak with a supervisor. I said, because I've received 2 different answers, I really want to talk with a supervisor and find out which one it is. And so I was on hold for 5 or 6 minutes. And that same girl came back on and she said, well, she says it's 6 months from your hire date, from what they put on the paperwork as the hire date. Okay. So I came home and I looked at the paperwork that was submitted by my husband's employer, and of course they put it wrong. They put it a month earlier. He was not considered permanent until April 15th, I think. I have the paperwork right here. But they put March 15th, which totally screws me. Of course. So, March 19th they put, and it was April 19th. So, what that means is, I don't know. Because okay, but then the story continues, sorry. So, I came home Monday, and that's why I didn't want to do a video. I was so stinking upset, because now you have to wait a year. I don't know whether the year is from the appointment, whether the year is from the hire date, whether the year is from the insurance started. I'm not about to ask that question, because I don't want to get further ticked off. And I figured at that point, I'll just wait, see what the doctor's office finds out, because, they'll probably get a better answer or whatever. So I thought... so I was kind of, bummed about it because, first of all, we waited all this time from last year. Obviously, the last IUI I had was in October, and we've waited all this time. I was so excited to get my insurance back. I was excited when I went to see the infertility doctor because, he said, I don't expect any problems. This should work. I'm thinking, okay, we'll get pregnant this year. There will be no problems, yeehaw. Well, I didn't hear from I called the doctor's office on Monday, the infertility doctor's office. She says, oh, we're so busy. I haven't had time to check the benefits, and I won't check them until Friday. And I'm like, what? You're waiting a week? They're waiting to schedule my surgery. I need to know if I'm having one surgery, dual surgeries, what the deal is. And I kind of gave the girl an attitude, and I'm like, this is ridiculous. According to the doctor I just went to, this is a huge life-threatening thing. They need to get this scheduled, blah, blah, blah. So whatever. I didn't call. I didn't worry about it for the next couple days because I was just so frustrated and just so upset that I said to heck with it. So today, which is Friday, a week ago, a week and a day ago, I had my appointment with the infertility doctor. They call me and tell me, she basically tells me she didn't find anything out. She doesn't really know if it's covered. They do have pre-existing on some stuff, not on everything. So I said, so, what do you want me to do? And I explained the situation where he wants to do surgery. And I guess the person that checks the, the person that checks the, why is this so high? I'm just noted, I don't know. The person that checks the, benefit eligibility for the surgery is different than the person that checks it for infertility treatment. So hopefully the person that checks it for the surgery has a brain more than this girl did. But, it just bugs me, like, that is your job and you cannot get a definitive answer. I mean, what do you expect me to do? So basically where I left it with her is, you know what, I'll come in for procedures, and if they're covered, they're covered. If not, we'll pay out of pocket. I found out how much they are. The ultrasounds are $270, and the IUIs with the sperm washing are $275. So, and she said there's a 20% discount if you do pay out of pocket. So what I'll do, I'll go in for the first one. They'll bill it to the insurance, and if it comes back covered, it comes back covered. If not, we'll pay out of pocket. I mean, that's not terrible, and we can probably do that for 1 month, which is all we can do anyway until I have the surgery. So, let's see. So that's pretty much, I'm pretty much still waiting. I called the doctor's office that's going to do the gallbladder, and because I called and I said, I haven't heard anything, and they made it seem like I would get a call back that day with a surgery date, because then you have to go in for blood work and whatever else. And I told them, I said, I think it's kind of odd I haven't heard. And they said, well, it's not odd you haven't heard, and she's going to call you later today. And it's now 1:30, still haven't heard anything. My guess is I won't hear today. And the thing that kind of irritates me is, all this happened whatever Monday's date was, June 7th, and I asked him in the appointment, I said, how long does it take to schedule? Oh, not too long. He said, it depends on my schedule, especially trying to match it up with the other doctors, but it's usually not too long. So I took that, that meant it would happen in a couple weeks. And the main thing is we're going away for July 4th weekend. I cannot have surgery right before then because it takes you 4 days to get back to normal and everything. So I cannot have surgery right before then. So, I hope they don't waste their time by waiting forever to schedule it and then schedule it right before the 4th of July weekend, because I'm not canceling my plans. I don't know, I'm just so frustrated that, and I'm not too, impressed with the specialist office anyway, because, when I went there, this girl was sitting next to me, and I don't know, we got talking, and she had surgery on something, she didn't have her gallbladder taken out, something else. And she ended up having complications, and she was there for the follow-up from those complications. They didn't even have her in the system. So that worries me a little bit with the office staff. I mean, the doctor seemed fairly confident, and he knew what he's talking about and everything. But the office staff just seems to be whatever, and that kind of worries me a little bit. But I don't know, what can you do? So at this point, I'm just going to wait to hear if they schedule the dual surgery. They schedule it. I assume they'll get it covered. I'm assuming they're not going to expect me to pay out of pocket for that. I'm sure that the person that does the surgical pre-qualifications or whatever will make sure it's covered. But anyhow, I'm just waiting to find out more information. Meanwhile, I don't know what the heck's going on. But I just wanted to give you guys an update. Let's see what else. Really nothing else. My husband's working a ton of overtime, so, I figure if we're going to spend it on anything, we might as well spend it on fertility treatments. So we're just kind of waiting on that. So I hope everyone's having a much better week. I will do another video as soon as I hear something to let you know, how many surgeries I'm having or what's going on. Pretty much my plan of action is if I do go ahead and just have the gallbladder out and they're unable to do the other surgery, that following cycle month will pay out of pocket for the injections and for the ultrasound, and hopefully, or for we already have the injections for the ultrasound and the IUI. Hopefully it'll just work and there'll be no other issues and I don't have to worry about it. because they'll obviously cover pregnancy would be a new diagnosis. So talk to everybody later. Lots of baby dust to everyone that is trying. Hope you have a great day. Bye.